Everyone, today we'll be looking at the topic of amyloidosis. Amyloidosis is a topic many a times asked as a short note. Now, when we talk about amyloidosis, it is basically a pathological proteinaceous substance that accumulates in the extracellular space. To simplify the statement, just understand one thing. It's a pathological proteinaceous substance, which means certain kind of reason is going to be behind it. Okay, it is happening because one or the other systemic disorders, okay, some pathology is related to it, and it is nothing just a proteinaceous substance which is present in the extracellular space, which means it is not going to be inside the cell structure. It is always going to be outside the cell structure, so never seen inside the cell. Okay, moving ahead with the classification of amyloids, we have either the systemic ones or we have the localized ones. Looking at the first one, that is the systemic one, it could be of two type, the AL type, that is the light chain, and the AA type. Now the AL type is said to be primary amyloidosis and the AA type is said to be the secondary amyloidosis. Clear with this? Now coming to the localized one, which has just the brief towards one particular location. Okay, it's kind of localized to one particular location. So here we have the A beta type, A beta 2 M type, endocrinal amyloidosis, familial type, and the senile amyloidosis. Senile is basically old age. Okay, so very easy till now. We saw what amyloidosis is. It is a pathological proteinaceous substance in the extracellular space. It could be of two type, either systemic or localized. Systemic is further AL type or AA type, and localized could be of 5 different types: endocrinal, familial, senile, A beta 2M, and A beta type. Now coming to the first one, that is the AL amyloidosis. The L here is standing for light chain. Okay, the L here is standing for light chain. So it is the AL type of amyloidosis, primary one. The most common type of amyloidosis in the world is this particular type. The causes here is formation of immunoglobulin light chain. As I told you, there are light chains which are formed inside the body that leads to formation of AL amyloidosis. It can affect any part of the body except for the CNS. Need to remember this, except for the brain portion, it can affect any part of the body. The most common organ to be affected here is your kidney. Whenever patients come with the complaint of amyloidosis, the most common affected organ is the kidney. The most common reason of death here is your heart failure. Now this is something very different. If somebody is asking you what is the very common organ affected, you will say kidney. Then why is renal failure not the cause of death? The cause of death is going to be heart failure and not renal failure. Kidney could be the most prominent organ affected, but the reason for death, the most famous reason for death, is the heart failure. You need to remember this. This was all a little about AL type. Now coming to the AA type, which is said as secondary amyloidosis. Now this is associated with chronic inflammation. Whenever chronic inflammation occurs in the body, which means that inflammation that persists for a very longer period of time, then it is a case of secondary amyloidosis. Again, the cause here is excessive production of the SAA protein in the liver. So whenever the SAA protein in the liver is hyper excessively produced, it leads to a condition known as secondary amyloidosis. Again, remember, it is a non-immunoglobulin protein. Okay, it is a non-immunoglobulin protein, unlike the AL type. It is not like the AL type. Secondly, here the most common organ affected, again kidney, but here the cause of death is your renal failure. So just this is a small exception. Here heart failure is the reason of death, but in the AA type the renal failure is the cause of death. Conditions where you can see the secondary amyloidosis, it is the rheumatoid arthritis, TB, osteomyelitis, renal cell carcinoma, or the Hodgkin's lymphoma. Now we are done with the systemic ones. We come quickly to the localized ones. In the localized ones, we have the A beta type. Now due to increased beta chain protein, see the name itself is telling you the cause. A beta type is happening because the beta chain has increased. The beta chain of the protein has increased. Commonly it is seen in the Alzheimer's disease, forming a senile plaque around the brain. What does this statement means? For example, This is your brain. What happens in Alzheimer's? The patient is not able to remember even small things. We assume that there is certain plaque which is being accumulated around the brain. What happens? Plaque is basically dirt covering the brain so that it's not functioning properly. Same is the example here also. Because of the A beta type of amyloidosis, there is Alzheimer's condition that happens, which is a kind of condition where it feels like senile plaques are being accumulated around the brain. So basically around the brain there is plaque formation, which is again extracellular deposition. Coming to the second type, A beta 2 M type. Here again it is happening because of beta 2 microglobulins. Beta 2 microglobulins, easy to remember. Increase in the beta 2 microglobulins. Here it was just increase in the beta chain of protein. Now it is mainly affecting the joints. So what happens in the joint region? There is accumulation of calcium, and especially over the carpal tunnel, leading to the carpal tunnel syndrome. So there is deposition over the calcium over these joints, leading to the carpal tunnel syndrome. Next we have is the endocrine amyloidosis. This is basically increase in the hormone. So whenever there is increased hormone levels, it leads to your endocrine amyloidosis. Example could be medullary carcinoma of the thyroid gland, or it could be type of diabetes mellitus where the insulin requirement increases. Okay. Next, coming to the familial amyloidosis. As the name is suggesting, it is a familial type. So you'll see the most common thing you'll see here is the increased mutant form of protein is the reason why this is happening. So usually we have a protein said as transthyretin. When the transthyretin undergoes mutation and this muted level is going to get increased, it leads to your familial amyloidosis. Not at all complex, guys, it's very easy. There is a protein named transthyretin. This transthyretin, it gets mutated and then it increases. After the mutation, the muted form is going to get increased. That is an example, or that is a cause of your familial amyloidosis. Okay, the example here is the familial amyloid polyneuropathy. Just remember the name polyneuropathy. Lastly, we come to the amyloid of senile age, that is your old age. It is due to the increase in normal formation of the protein. So when there is increase in the normal formation of the protein, it leads to your amyloid of the senile age. Organ commonly affected is your heart. In the liver, it could be seen at the space of Disse. Very important point. The organs here affected is heart, liver and spleen in this condition. When it is affecting the heart, in the heart there is a structure known as space of Disse. So that space of Disse is the place where the amyloids are going to get, where these proteinaceous substances are going to get collected. Okay. In the liver, the proteinaceous substance or the amyloids, they are going to get collected in the space of Disse. And in the spleen, it can lead to formation of two type of spleen, the sago-spleen or the lardaceous spleen. Here you see this is a normal spleen. Everything is healthy, smooth texture, no problem, right? Now when the amyloids, that are small proteinaceous substances, they accumulate like this. You see, when they accumulate like this in circular manner, it leads to formation of sago-spleen. And when they arrange in a map-like structure, when they are going to get affected in a map-like structure, they are said to be the lardaceous spleen. There is no cure for this. You need to understand one thing. Amyloidosis is a condition. There is no cure for this condition. If it happens, we can only go with systemic preventions. Okay. There is no cure for amyloidosis. Only systemic care could be done. So this was all about amyloidosis. If this comes as a short note, make sure you're writing every type of the amyloidosis and explaining every type a little bit. So first we discussed the first one, that is the AL type. Then we discussed the AA type, which is secondary amyloidosis. These two above one, the systemic ones. Then we came to the localized one. Here we saw the A beta type, the A beta 2 M type, the endocrinal amyloidosis, the familial amyloidosis and the amyloidosis in the senile age. Again, questions like this, what is Lardacious spleen and what is Sago spleen, are very, very important. I hope every doubt of this topic is clear. Still, if any confusion or any questions are there, please write it down in the comment box. Also, give me your reviews if this video was helpful to you or not. Thank you.